honor of Childhood Cancer Awareness Month, we're sharing the story of a young man who's inspired other kids through his own journey. News 8's Brittany Flowers joins us in studio with this story. Brittany?
Yeah, Rick. Well, Connor Pung is a sophomore at Grand Valley State University. He's always enjoyed being active, but now cherishes his physical ability more than ever before. For Connor Pung, each step around the 9th floor of Corewell Health Helen DeVos Children's Hospital brings up a lot of emotions.
It was really emotional, really difficult to walk back through the same places that I had struggled to walk through.
The spring of his junior year of high school, Connor found himself in the emergency room.
They did an x-ray. They found that there was a mass in my chest spanning from kind of my lungs to my upper collarbone.
He was immediately put in the intensive care unit at Helen DeVos.
They ran a lot of tests on me. They did biopsies, many surgeries to figure out that it was non-Hodgkin's lymphoma.
Connor's treatment consisted of 5 days at a time in the hospital, followed by 2 weeks at home. It was the most challenging time of his life, but it also came with a sense of peace.
And I felt like God saying, like, you're in my hands, I got you. There was a lot of family support as well. Friends would check in and text regularly.
But there's another key thing that got Connor through.
I started walking every day.
One of the child life specialists told Connor how many laps it would take to walk a mile around the 9th floor.
One of the things that they said is if you're really ambitious, you could do a marathon. And I thought that would be really cool.
It's safe to say Connor crushed that goal.
4 out of the 6 times that I was here for treatment, I was able to walk a full marathon, which was very cool.
Through the exhaustion, nausea, and foot blisters from chemo, it was the walking that got him out of bed every single day, and it inspired other kids with cancer to do the same.
There was a parent that came by and told me, hey, my child started walking because of your example, and that is when I kind of realized that this is bigger than just me.
Connor managed to graduate as valedictorian of his high school class, and in January of 2023 learned he was cancer-free. That spring, he hosted a walkathon to raise money for the Pediatric Oncology Resource Team at Helen DeVos to start, you guessed it, a mileage club.
This is an experience that hopefully not a lot of people my age will have to go through.
But if they do, they now have a motivator and can earn medals for completing a 5K, 10K, or if they're as ambitious as Connor, a marathon. His hope is to see other hospitals offer a similar program to encourage kids everywhere to push through, just like he did.
I mean, this could help a lot of different kids.
We spoke with Connor's doctor, Beth Kurt, about some of the data regarding pediatric cancer patients. Dr. Kurt says, though childhood cancer is not common, about 16,000 kids are still diagnosed every year in the U.S. She adds physical activity is incredibly important for young people going through chemo, and that Connor has left a lasting legacy for other kids and teens to be active and to take control of their own wellness. Over the past several decades, the outcomes of kids with cancer have also greatly improved.
Nowadays, about 80% of kids will achieve long-term survival from their cancer, which is really exciting. But we do know there's work to be done. That cure comes at a cost, and we want to continue to pursue therapies that will not only have excellent cure rates, but also reduce the burden of treatment side effects on the kids.
You can take part in Childhood Cancer Awareness Month by raising or donating money to research, sharing your story, or wearing gold to show support for patients everywhere who have previously or are currently battling cancer. Reporting in studio, Brittany Flowers, News 8.